Well, we all want healthier kids, and to support them in their health, we really need to know what things are going well. We also need to know what challenges are they facing in their health.
Are they thriving? Our goal is that they lead healthy and happy lives, and by using an instrument that is standard across the state, we can assess that.
So the Healthy Youth Survey looks at health of youth as well as their risky behaviors and the risk and protective factors within the community and individual level.
Every school needs to identify where they're strong and where they can do better. And so Healthy Youth Survey data was one of the metrics that we would use, especially when we wanted to look at how our students felt about things that we were doing.
Being able to understand some of the health behaviors and health attitudes that students have allows our community partners and schools to address some of those behaviors and attitudes earlier on before they become more of an issue or problem.
Everyone wants to talk to young people at a state level, and the Health Youth Survey gives us an opportunity to do that. So as state agencies, between the Department of Health, the Healthcare Authority, the Liquor and Cannabis Board, along with OSPI, work together to coordinate what is it that we need to know from young people to help us inform policy development, implementation, resource allocation, evaluation of effort.
And so there's a lot of people that are helping to create the questions. It's a community investment. I would say at state and county level, there's stakeholder investment in the development of the survey and its evolution. And I've been, looking at it for so many years. I've seen how each cycle there's a change, or a question that was asked last cycle is skipped this time, but then it's asked again another time, and that's a long-term strategy to get good data stretched out over years.
Health is not just the absence of disease. Health is a holistic concept that involves not just physical health, but also mental health and social health. And so these are all of the things that we have in the Healthy Youth Survey. So not only do we ask about physical activity and nutrition, but we also ask about their emotional health. We also ask about substance use. We also ask about connections and social strengths. And so this is all really important to get a holistic understanding of kids' health.
So definitely it's grown over time. The more we know about young people and their characteristics, so some of those demographic questions have gotten much more sophisticated just because we've seen the nuances. The more we know about who those young people are, the better we're able to develop and implement programs to meet specific needs, as opposed to kind of generalizing across all students need this or all students need that.
Youth are diverse in so many ways, and so asking these questions of gender is important, so we know where our resources can be allocated, not just in gender, but in topics and themes in health and risky behaviors, or again for the community level risk and protective factors. And the questions are asked specifically to different age groups, and each question in different age groups is asked according to age appropriateness.
We really want this survey to be inclusive so that all kids feel comfortable participating and all kids can see themselves in this picture of youth health that we create with the survey.
So the survey is completely anonymous. Students do not have to put their name on it. There's not even a place for it. They don't collect emails. It's very anonymous.
No student is required to take it at all, and no student is required to answer any question they're not comfortable answering. That's the whole point of the survey, is it's voluntary information that the kids are volunteering to give so that we can help them. And I encourage them to answer all the questions.
We're required, based on the International Review Board, or to follow the ethical standards, that we notify parents in our community in a couple of different ways that the survey is coming up and that they can opt a student out. So the community has a chance to let our building know, hey, I don't want my son or daughter to participate in this survey. Students can opt out of a question, they can opt out of the whole thing, they can change their mind and stop doing it.
I would hope that, given the things that we've offered about the survey is anonymous, it's voluntary, you can opt out of the survey, all those things that we've built in allow the majority of young people to take the survey so we can hear from them.